everybody. So excited to be here for today's Power Bite. I mean, this is an amazing topic, one that is of high interest to a lot of us who are in the health space. And that's going to be digital health and AI and how does that affect population health? Today, I have someone who I've been so excited to talk to. Sarav is going to be joining us. So Sarav, can you please introduce yourself to everyone?
Thanks for having me on this great forum, and it's a pleasure. So I'm Bala. I'm a practicing clinician. I've been practicing medicine for the last 16 years now, and have a lot of passion towards understanding how digital health and as well as how machine learning can have an impact on me trying to do what I'm doing with a few of my patients. How can we take it to a much bigger level, understanding the lengths and breadths of what are all the different elements which can impact disease progression? What are all the different things that could potentially impact prevention of disease by not just giving a pill, but also by making a lot of small changes in patients' behavior, which substantially can decrease disease progression and also can overall increase longevity and also quality of life. So that's my firm belief in adopting a significant amount of practice with AI, with which I can do a lot more than what we were able to do all these years.
When we think about AI and digital health and machine learning as it relates to healthcare, what is it that we should be thinking out for those of us who are in the population health space who don't operate within this area? What is it that we should be thinking about? What does it mean?
For that, first, we need to quickly know what is AI and briefly, and what is machine learning, which is a subset within AI. Anything that's digital and anything that can be replicated with the machine, with the program, which we do, is basically artificial. It's AI. Machine learning is a subset within AI where we are not just replicating what we're trying to do, but also we are training the machine to think like us and somewhat like act like us, though it cannot do that at 100%. We are not there yet, but at least there are things which we can train the machine to do, the computers to do. So that's machine learning. How does it impact population health? So it just goes back to the whole idea of what we're trying to do at a large scale and scope. So what a provider can excel in, that can be taken, and many of those variable attributes which a lot of individual providers excel in can be taken and scaled up to large populations. And that's where we are really trying to make an impact on bending the disease and the cost curve to get to the roots of where the patients are and how do we get to them. There's minimal accessibility. There is not many resources we have, very few doctors going into med school. Nurses, the numbers have gone down substantially. So we need a way of getting down to the patients where they're at. So using digital health and also utilizing machine learning to understand disease patterns and lifestyle patterns and how that can impact disease back matters a lot, and how we can really make an impact at the touch point level, at the patient level, going all the way back to the whole population as such. So that's why it's so critical for us to embrace and adapt digital health, AI, ML on top of what we do as clinicians.
I think what you're talking about is so important on several different levels. And when you talk about, some of the obvious staffing issues that we're all struggling with every day, and I'm sure you see firsthand, and then the health disparities within certain communities, and then allowing, AI and digital health to come in and help to inform how we're doing that now. And and I'm sure you recognize as I do that there are some areas of different communities who are a little concerned that there may be some other, perpetuation of bias, et cetera. So, I mean, just so in that, and with all the pros and the cons, and it's highly necessary, there are different kind of policy lenses that we can look at look at this through. What are the policy implications, or should there be, for when we're talking about AI, especially?
So the first part of the question is, how does AI impact or positively or negatively on health disparities and social determinants? So we're all well aware that the way diseases manifest is different amongst ethnicities, different amongst what happens in different social determinant subgroups. So access to care, for example, just one example, just having inadequate access to care, irrespective of having the same disease within exactly a biological identical twin, will substantially impact how the disease progresses in somebody who does have access to care as opposed to who doesn't. So all these social determinants. There are numerous social determinants like food insecurity and housing inequality, how it can impact the same disease in the same person with the same genotype and phenotype. So that's well recognized. And then the health disparities. Certain diseases manifest differently, both at a genetic level as well as at a phenotypic level, on certain races and ethnicity and certain backgrounds, male, females. And that's again something well known to medicine. First of all, we need to understand and embrace that disease does not show a certain level of preference. There are disparities in how diseases choose to express themselves across disparate populations. So when we are approaching those diseases, we need to be cognizant about that upfront, understand that, accept that, and then develop policies and protocols on how we can address health disparities, remembering social determinants while we implement disease mitigation strategies. And the most, I mean, as a clinician practicing this many years, implementing that at a bedside level is not that simple. But having the knowledge about these disparities do exist, using a digital platform and a scalable platform, and then understanding and implementing strategies with using a digital and a machine learned platform, which augments your clinical touch point, be it a nurse or a social worker who goes and works with the patient or a provider, makes a huge difference having that upfront knowledge. And then how much is too much? We come to the policy part, right? And how much lines are we crossing? Are we picking and choosing here? And who should be getting and shouldn't be getting healthcare? So these things need to be fairly regulated within each institution, which delivers and provides care to a specific population, or it can be a risk-bearing entity. But beyond that, I think it does a lot more good because we understand disparities exist. We recognize ethnical disparities and male-female disparities does exist. Knowing that, embracing that, and then generating policies and actions based on that will hopefully eliminate the likelihood of selective biases in healthcare delivery. So there needs to be regulation, at the same time not a whole too much because it kills innovation.
That is a fine line. As you're talking about this, and I'm just thinking about some of the conversations that I've been involved in related to AI and machine learning, and not just in the healthcare space, right? But as that's starting to expand out, and we're seeing, writers and actors striking because of, some of the concerns related to this. So as we're talking then about within population health and the impact on the different types of organizations involved in population health, and I think you kind of talked on it, spoke to this a little bit. But if we were to really kind of pull the lens out and look at this broadly for anyone who's involved in affecting population health, so that can be the providers, right? That can be the direct care providers, but it also can be other stakeholders in terms of the payers and political, local, and state and federal. So what impact then are we focusing on in terms of the direct benefit, the big benefit for population health, to population health, of having a solid digital health or AI approach and strategy?
Most populations, the few patients or members, call it like the 5 to 7% of members, patients who actually are going to be costing a good 45 or 50% to the healthcare system, are always sitting there, which not many of them are able to recognize. The traditional approach with several payers as well as pop health entities they go back to the prior year, look at who are those members who actually were the sickest, had the most number of hospitalizations, and who cost too much to the healthcare system. And then strategies are applied towards those members to see if those can be prevented. But that being said, we're not paying a whole lot of attention to who's going to be going back into that pool. Who are the other members who are out there who could potentially be high or ultra high risk the upcoming year? How do we even know that, right? I mean, physicians with longitudinal patient relationships or nurses, they would know that. But again, still, it's not scalable. That's where machine learning is important to optimally risk stratify the members at risk in a large population set. And then once we know who are the members at raising risk, and then the members with existing risk, strategies can be deployed because again, workforce is limited. So strategies can be deployed on those members who are potentially going to be going into that ultra high risk or high risk, silo, and we can prevent or mitigate them from not progressing. And then the rest of the folks, what happens to them? Are we waiting for them to go into ultra high risk or high risk? No, we need to have some level of risk stratification across the population to see who are those members who potentially can go from no risk to some risk. And then what is the predominant disease prevalence out there using machine learning? We can figure out what are the 4 or 5 top diseases which potentially has got the largest prevalence in this population, and what can be done about it. And why is number one, it the most prevalent disease? Why is diabetes so common in children in this population? There's something wrong, right? Either it's food insecurity, or there's there are stalls there which should not be there as much as it's out there, with sodas and all the stuff which the kids should not be having access to. So it gives us a lot of insight on how to approach healthcare, not just pills, not just doctor's visits, but also at a societal level. What should we be doing for the whole population? For example, high risk pregnancy, or how social determinants impacts high risk pregnancy. It could just be a matter of arranging transportation for some of these high risk moms who could be high risk pregnant downstream and not have access to good family medicine docs or OBGYN. So it could be a lot of these community things which can be implemented, not just therapeutics in decreasing risk progression. But we need to know who they are. And without AI, without machine learning, I can't think of a better way to find out in 1 million people who those 1,000 members are.
As you talk about risk stratification, and it's such a fair and important point, to a certain degree, that's what a lot of us are doing. However, to your added point, are we keeping people from going back in? And I think that's something that we can't lose sight of. So you've done amazing work in this space, and that's what I want to kind of pivot to right now in our last few minutes or so. What is the great work that's already being done? Who's laying, in addition to yourself, laying some of the great paths that we should all be following and using as examples? Like, what are some of the great innovations that are already happening?
This whole concept of pop health and a population health and disease mitigation is a clinical issue. It's a clinical, because the downstream effect is a clinical impact and a clinical problem. And when it becomes a clinical problem, we need to have a strong upstream clinical solution. So any solution, any entity which is able to understand that it is a clinical issue upstream with a significant impact on, from social determinants and behavioral health. When we bring those two major elements together and then understand the clinical attributes of how certain populations can progress or not progress to a certain disease or not, layering the foundation of analytics with those elements and then building their analytic platform on however way they do it, it's up to, there are many ways of doing this, but having that foundation, the clinical foundation, along with social determinants and behavioral health, is so critical. Once a foundation is a platform is built with that foundation using several different models, one would be able to have better understanding of where the problem is, and most importantly, why is this a problem? And even further, what are the gaps which are leading to that problem? And finally, what can meaningfully be done to mitigate that problem? So to complete that whole curve, what we call as a disease mitigation curve, one needs to fully understand not just the disease, but also the other factors that can directly influence disease, which is predominantly your SDOH and behavioral issues. So any platform that can do that, again, I'm not going to put a whole lot of names. There are a lot of great people have a lot of ideas that want to do that. And then taking that all the way down to the touch point. How can they get this information to the people at the touch point in a nice and simplistic way so that they can implement that? And how can that information be taken to the patients so that they can understand and practice that and reach out for help and service when they need it? So that's the execution part, which is, again, super critical. A lot of people struggle there on that segment because the adaptability of all this digital problem. There's so many apps in everybody's phone nowadays, right? Which one is good? What should I follow? What should I not take? So that part is challenging, but the foundation is critical.
Everything that you've said, it's definitely given me something to think about. I'm hoping that everybody who's watching this is taking as much away from this as I am. As I'm wrapping now, is there one thought, one recommendation that you would leave with the folks who are joining us for Power Bites today? What, just on this topic, is there one thing that you would say, okay, if you don't remember anything else, remember this? What would that be?
Have a clear understanding of raising risk, because without that, we are shooting in the dark. And we need to answer internally 4 questions when we understand raising risk. Who, why are they at risk, what, and what is the consequence of them being at risk, and how do they mitigate that risk? And if we can complete that process, any analytics should have this journey. Any analytics which just does one of the four, or two or three of the four, is not going to be sufficient, because we're going to find somebody else to do the fourth part, which means you're going to have two separate things trying to connect with each other. You're losing the whole concept of attributes, variables, and machine learning. So risk stratification, and then with answering all these four questions, is super important while we escalate and scale up some of these machine learning platforms.
As you're saying this, I'm going to take those four questions back to my team and actually challenge ourselves to think about if we've addressed each one of those. Thank you so much for spending your time with us today. And for everybody who's watching, thank you for joining us for Power Bites. And don't forget, if you haven't already done so, to make sure to sign up for the PHA Innovation Summit that's going to be happening in October in DC. So we really want to see you there, where you'll get to hear from experts like this one and many others on topics like this. So thank you all so much for joining us, and we look forward to seeing you in October.
Thanks for having me, Melissa. Thank you very much.
Looking for more answers in population health? Be sure to attend PHA's Innovation Summit October 25th and 26th at Top of the Hill in Washington, D.C. Learn more and register today at populationhealthalliance.org.